I'm Glenn Campbell. I call myself a demographic philosopher. I'm looking at life and trying to predict the future through the lens of demography, or the study of human populations. In this episode, I'm talking again about the coronavirus outbreak in China. It's now the early morning of Monday, February 10th, 2020. It's been a month since the first mention in the New York Times about the virus. That was January 8, and I consider that day zero because we really don't know when the virus started infecting people, but we do know when we started learning about it. Back on January 8, there were no officially reported deaths, but now we're facing a worldwide pandemic. Today, officially, there are some 40,000 confirmed cases and over 800 deaths, mostly in China. But both of these numbers are presumably undercounted. By some accounts, there could be 300,000 cases and many thousands of deaths. We just don't know. It's hard to know because China has such a history of distorting statistics in its favor. Now, I don't usually talk about breaking news on this podcast because demography is concerned about long-term consequences, not current events. You could be listening to this episode months or years from now, in which case whatever I say is going to sound naive. There's a lot we don't know yet, but what we do know is such a big story that I just can't keep quiet about it. This could turn out to be the biggest worldwide crisis so far in the 21st century. There have been wars, but they have been local. It's looking increasingly likely that this is something that's going to affect everyone on the planet. This thing could kill an unknown number of people, but even those who remain alive are going to be living in fear. Their lives are going to be profoundly disrupted. Regardless of the death toll, this crisis is going to upend economies and probably trigger that massive recession I've talked about in previous podcasts. That financial collapse is probably the biggest story here because the virus will eventually burn itself out, but it's not clear that the economic crisis will. Now, I don't want to be your source for information on the coronavirus because there are better sources online. I think of this episode more as a time capsule or diary entry. I'm trying to record what I was thinking at a pivotal moment in history. It's also an opportunity to make some predictions and have those predictions proven true or false very quickly. We're talking about timescales of days and weeks here, not years. I'm predicting, first of all, that we will have a vastly different world a month or two from now as news of the virus takes hold and people outside China start panicking. For the record, there's no panic in the United States right now. Stock markets are still flying high as of Friday, and no one inside the United States seems to have altered their plans for the virus. All it takes is a few high-profile cases within the U.S., and everyone will instantly change their behavior. They'll hunker down, avoid contact with other humans, and stop spending money on frivolous purposes. And this is devastating because most of the economy is frivolous purposes. When people stop buying cars, stop eating in restaurants, and stop shopping for the latest fashions, the pillars of our economy will start collapsing. We're already vulnerable because the world in general has taken on far too much debt, and it only takes a little push to start a whole cascade of failures. In previous podcasts, I've talked about a black swan, some event that's going to come along and trigger this recession that has been waiting in the wings for some time. And lo and behold, here it is. This coronavirus is the black swan. It's the trigger that's going to set things off. It didn't have to be this trigger, but this is what we got. So what has happened in the 7 days since my previous podcast when I first talked about the coronavirus? Well, the infection has grown exponentially, and it's increasingly clear that it cannot be contained. China has taken some draconian measures to lock down huge portions of its population, but the thing is still spreading. The main problem with this virus, apart from killing a lot of people, is that there are a wide range of symptoms from mild discomfort to death. Most people, in fact, seem to suffer only moderate distress, equivalent to the common cold. This is actually bad because these people don't report their infection and don't quarantine themselves, so they spread it to other people who might actually die. There's no reason to see a doctor if you have only a routine cold, and in China there's strong incentive for not reporting your infection because you'll essentially be arrested for it. That means there are probably far more cases than officially reported. The official figure of 40,000 confirmed cases is something of a joke. It may only reflect the number of test kits that they have. Statistical modeling by Western scientists seems to suggest there could be 300,000 cases or more. And it is really, truly killing people. Even though most people get only mild symptoms, those who show up at the hospital are dying in large numbers. One of the big symbolic events of the past couple of days is that a Chinese doctor, who was among the first to alert others to the disease, has himself caught it and died. He was only 39 years old, presumably healthy and with good access to medical care. One death doesn't tell you anything about fatality statistics, but it made me realize that this isn't a game. This is a real killer. In the last podcast, I said that the best estimate for the fatality rate was 2 to 3% of the people who catch the disease. I kind of regret saying that now because we just don't know. Statistics out of China are really dubious. The government has a long history of manipulating them in its favor. But even if we take these numbers at face value, they aren't saying what they seem to. If you take the number of fatalities and divide them by the number of cases, that is 800 deaths over 40,000 cases, you get a fatality of 2%. And if you think there are really 300,000 cases, that's a fatality rate of 0.3%. This doesn't sound too bad until you realize that people don't die immediately of the disease. It takes weeks after infection before people die, which means we need to look at the infection rates as they were at the time of infection. So if 800 people are dead today from only 10,000 infections a couple of weeks ago, then the fatality is more like 8%. But the bottom line is we just don't know what the fatality rate is yet. All we know is that people are dying in large numbers, much more than the common flu or the SARS epidemic in 2003. China is taking all sorts of dramatic measures to control the virus, like locking down cities and building hospitals, but it all seems like PR at this point. Within China, there seems to be no evidence that the virus is being contained. And it is increasingly clear that it's jumping borders into other countries like North Korea. Once a virus bleeds into a place like that, or India or Africa, where medical resources are poor, it will really become unstoppable because everyone's going to get it. The general consensus among experts is that the virus will become endemic, which means that eventually nearly everyone on the planet will be exposed to it. Sooner or later, nearly everyone's going to have to spin that big roulette wheel that determines whether the virus kills them or just gives them a bad cold. In the long run, we can't prevent the virus from spreading. We can only slow the spread, which is actually quite critical. Hospitals don't have a cure for the virus, but there are things that they can do. They can provide supportive care like giving oxygen and providing antibiotics for secondary infections, and that greatly improves the chances of survival. The trouble is medical resources are limited, and they're optimized for the disease profiles that we have now. If a hospital has only 100 intensive care beds and 1,000 people show up with symptoms, that's 900 people that can't be accommodated. I understand, for example, that there are only about 100,000 intensive care beds in America, and most of them are already occupied with routine cases. If thousands of people get the virus or just suspect they have it, medical services are going to be overwhelmed and most of those people won't be served. You'll have people dying in hallways and at home because they couldn't get into the hospital. That's why it's important to slow down the rate of infection. Even though everyone's going to get it, you want to slow things down to the point where the medical system can handle the new cases. And it's not just a matter of building more hospitals. China famously erected one in about 10 days. The problem is staffing and supplying those hospitals. You can't magically create new doctors and nurses in 10 days. The best you can do is quickly train some lay people on the essential tasks of care, which still takes weeks. So the best way to maximize survival rates is to slow the infection down, which means educating the whole world on how to avoid infection. What is the best thing you can do to avoid catching the virus yourself? Now, I don't know what the guidelines will be, but they will soon be issued, I'm sure, and people will pay attention. I predict that people will get very motivated about this, knowing that their own lives are at risk. I've even started taking these precautions myself. A couple of days ago, I went to the dollar store and bought me a bottle of hand sanitizer. Now, I know the virus hasn't made significant landfall in the U.S. yet, but I don't think it's too early to learn good hygiene. It appears that the virus is spread in 3 ways. You can get it directly by touching an infected person, by breathing in droplets in the air when someone coughs or sneezes, and by contact with surfaces where droplets have settled or where an infected person has touched. The best information so far is that the virus can survive for up to 9 days on a hard surface. Regarding droplets in the air, you have to be fairly close to someone who sneezes. You can't get coronavirus by walking in the woods or staying inside your home if an infected person has never set foot there. You get it in places where humans congregate, like stores, buses, airports, schools, public restrooms. It's only when you go to these places or otherwise have contact with other humans that you need to take precautions. I don't even know if standard hand sanitizer kills the virus, but assuming it does, when should I be using it? I'm kind of thinking through the procedures that I should apply to my own lifestyle if the virus starts spreading in the U.S. Typically, I'm driving across the country in a car that I know is reasonably safe. So I only need to use hand sanitizer when I step out of the car and start touching things. In the past couple of days, I've become very conscious about what I touch. Now I'm touching a door handle, or I'm taking money from a cashier, or I'm picking up this or that in the store. The actual hand contact isn't the danger, since the virus isn't absorbed through the skin. You get infected when you touch something and then bring your hands to your face and touch your mouth, nose, or eyes. So that's really the main thing to be cautious about, touching your own face. So what I do with my bottle of hand sanitizer is that I put it on the driver's seat of the car whenever I step out. So the inside of your car or the inside of your home is a sterile zone. You know you're safe there, at least if you're not sharing the space with someone else. You can do anything you want within your sterile zone. But once you step outside, you're in the danger zone and you've got to practice the recommended hygiene, whatever those recommendations will be. So whenever I step out of my car, I implement my hygiene plan. I remain conscious of everything I touch, and I'm careful not to bring my hands to my face. And once I get back into the car, I see the bottle of hand sanitizer on the seat, so I use it and thoroughly cover my hands. And I also put a little of it on the outside door handle I just used. And voila, I'm back in my safe zone. Experts seem to agree that face masks aren't very effective for preventing the disease, but they are effective for protecting others if you already have it, since when you sneeze, it holds back the droplets. For people who don't have the disease, the main benefit of the mask is that it discourages people from touching their own face, which is the real danger here. Surprisingly, there is still plenty of hand sanitizer in most of the stores I've visited in the past couple of days. This is important because it means that the American public isn't panicking yet. You know the panic has started when the hand sanitizer is sold out everywhere. For most Americans, coronavirus is still a problem of faraway China. All of that is going to change when you have a few high-profile deaths in your own country. That's when people start panicking. Now, an amusing thing about hand sanitizer, most of it seems to be made in China. So how are we going to get more hand sanitizer when it sells out? I assume American industry will eventually rise to the challenge, but it could take weeks or months. By the way, you don't have to worry about goods that were shipped from China, assuming that they start flowing again. If the virus only lives on surfaces for 9 days and it takes longer than 9 days for the ship to bring the stuff in, then you know you're safe by the time it arrives. Of course, if the product gets stocked and distributed within America, you could have Americans with the virus who are touching it. And you have to take precautions about that. I'm sure this will all be discussed ad nauseum in the media when the virus takes hold here. And it will take hold here. This seems to be the consensus of experts. There are too many people out there with the virus, and the fact that might be able to be spread when people don't have symptoms, and so many people have mild symptoms, it is going to intrude everywhere. But people haven't realized that. And the hand sanitizer, the fact that the hand sanitizer is still available in stores suggests to me that as of yesterday, February 9th, the American public is still in denial about the severity of this threat. I think the prevailing opinion among Americans is that this is no big deal. They think it's just like another version of the flu. People die of the flu every year, so why should this virus be any different? Well, it is different. No matter how you slice it, the death and complication rate is many times higher. People think that if they get sick, they can just go into the hospital and be cured, but you won't be able to get into the hospital because it will be so overwhelmed. The financial markets are also in denial. American stock markets are still flying high in spite of a couple of weeks of dire coronavirus news. This continues the recent pattern of markets rallying on bad news. Bad economic news boosts stock markets because investors expect the Federal Reserve to step in and lower rates in response. So right now, the prevailing opinion is that whatever happens, the central banks will save us, which only goes so far. They can only cut rates so far because interest rates are so low right now. But for the time being, investors seem to be ignoring all forms of bad news. Now, sooner or later, this denial has to end. The economic disruptions in China are already rippling through the world economy. Automobile plants outside of China are shutting down because they can't get the parts they need. And that's only the beginning. The world economy is highly dependent on China and on free trade between nations. And if any of that shuts down, the economy is in deep trouble. Now, the most important next step that I'm watching for in the next couple of weeks is a loss of consumer confidence. As soon as people realize their own lives are at risk, it will dramatically and instantly change their behavior. This change may pivot on some key story like Americans who have never visited China dying of the disease here in American soil. It takes just one news story to push people into thinking, wow, this thing is coming after me. Then they will suddenly go into self-protection mode where they hunker down at home and stop spending money. Our economy is especially vulnerable because most of the products and services we use are discretionary. They can be canceled or delayed at a moment's notice. Everyone needs to eat, but no one needs to eat at fancy restaurants, especially if it seems dangerous to do so. Americans may need to drive, but they probably don't need to buy a new car right now. Once confidence heads south, then all manner of businesses are in deep trouble because they aren't essential to anyone. The only essential things are basic food, utilities, rent, and medical care. Almost everything else can be put off, which people will do if they feel their lives or economic security are at risk. It seems clear to me that certain industries are already in deep trouble, even before the general panic begins. For example, passengers have already been held in quarantine on a couple of cruise ships, like one in Japan. Just one infected passenger on a ship could put all the others in lockdown. And the message this sends is that if you get on a ship, you might not be allowed to get off. So what is this going to do to cruise ship bookings? If nothing else, this is going to be devastating for the cruise industry for the rest of 2020. Not just that, but all forms of tourism are at risk. Most tourism these days involves traveling on a plane, a bus, or a boat, cooped up with fellow travelers, and the destination itself may involve human contact. I can imagine attendance at Disney World taking a dive if people perceive it as a place where you might get the virus. Disney has already closed parks in Shanghai and Hong Kong. Now, will this spread to Orlando and Anaheim? Even if they don't close the parks, people might just stop coming. People are also going to be reluctant to vacation overseas, fearing that they might not get back home again. Even a trip within one's own country might not seem safe. If the trip is discretionary, why take the risk? All of this adds up to a truly horrendous tourist season in 2020. The shipping industry is already in trouble because exports from China are down. A lot of Chinese factories are shut down right now, and it's not clear when they're going to reopen. A prolonged shutdown is going to have profound effects on supply chains all around the world. China makes a major portion of the stuff we buy, and even for stuff that is ostensibly manufactured here, like cars, China makes many of the parts. It also works in the other direction. Chinese consumers have stopped buying things from other countries that they don't absolutely need, which is devastating to export industries like lobster fishing in Maine. They can't get their products to the Chinese market anymore. Once you start thinking through the issues in supply chains and markets, you realize that the whole world economy is in deep doo-doo. Yet the stock markets remain in denial, at least as of Friday. We already have an everything bubble in the United States that has been growing for some time, propped up by low interest rates, and the virus seems like more than enough to pop it. But most investors don't seem to care. I predict that this unnatural calm is going to end very soon, like within days or weeks. Denial can only go on for so long before reality steps in and crushes it. As soon as consumers and investors lose confidence, the bubbles are going to start popping. Economic contagion can spread a whole lot faster than viral contagion. All it takes is some clear symbolic event that shows the virus can't be stopped. Stocks are going to crash, and nothing the Federal Reserve can do will bring them back. Eventually, the effects will ripple through the entire economy, the entire world economy. People aren't going to be buying unnecessary products and services, so the workers that produce them are going to get laid off. It will be like 2008, but much, much worse. This time the collapse won't stop because the central banks and big governments have essentially run out of ammunition. In 2008, we were pulled back from the brink of the abyss by central bank intervention, which ironically led us to the fragile position we're in right now. The next time around, we're going into the abyss, whatever that means. So the world will be facing two simultaneous crises, a viral epidemic and an economic collapse. There will be no place to hide. And don't expect the President of the United States or the Prime Minister of Britain to rally people and inspire confidence, because we all know who those characters are. This is a sort of Winston Churchill, Franklin Roosevelt moment, and we have no such leaders in 2020. Anything President Trump tweets is likely to make things even worse. On a worldwide basis, this virus crisis is going to go on for a very long time because countries and individuals are going to do everything they can to slow its spread. This is appropriate because we don't want patients overwhelming our hospitals. We just need to keep the virus at bay for the year or so that's required to develop a vaccine. Medically, it is better to have a slow pandemic than a fast one, and this can probably be achieved through public education. If everyone is practicing good hygiene, we can probably reduce the velocity of infection, even if we can't entirely stop it. Unfortunately, this means the economic effects are going to continue for a very long time. This might mean years of paranoid vigilance and reduced spending. Unfortunately, public reaction is not going to be limited to sensible precautions. I predict paranoia is going to rule the rest of 2020. Not only will people be taking appropriate actions to avoid catching the bug, they'll also be taking a lot of inappropriate actions, because they always do. They will be doing stupid things that conflict with medical advice because they feel like the right thing to do. Only time will tell what these stupid actions will be, but I remember the aftermath of 9/11. Among other things, it got us involved in 2 expensive and unproductive wars because it seemed like the right thing to do at the time. Back then, the pandemic was a fear of terrorism, and the reactions to that fear actually caused more damage than the terrorism itself. Eventually, medical science will produce a vaccine to protect against the virus, but that could take a year or more. By the time the vaccine is widely distributed and the virus is stopped, at least in developed countries, the economic damage has already been done. We won't be able to roll back the economic clock to 2019 because 2019 was an absurdity. It was unsustainable. I have no idea how the economic crisis will unfold or where it will end, but I know that once the crisis starts, it can't be stopped. For now, we'll all be watching as the coronavirus makes its march across the globe. There's nowhere you can hide from it unless you cut off all human contact. If nothing else, this will profoundly change how people interact with each other. Maybe they will stop shaking hands. Maybe they will stop attending conferences and conventions or eating at restaurants. I'm sure some people will barricade themselves in their homes. Online interaction remains safe, so if anything, we'll become even more virtual than we are right now, but the streets might look a lot emptier. I don't think I'm overreacting here, but time will tell. Even 2 weeks are enough to show whether I'm right or wrong. This will take us to about February 23rd. I'm going to go out on a limb here and say that by the end of February, stock markets will be in obvious distress. If I'm wrong, I'll admit it, but I don't think we'll have to wait very long at all. So pay attention. The next couple of weeks will be critical.